in how they engage with other nations in support for global health activities? And should these high-income countries reckon with their history of colonization and its impact on health? And finally, we seek to ask, how do academic institutions like the University of California address the impact of colonization on the work that we do, both globally and locally? How does the legacy of colonization perpetrated and perpetuated by the University of California frame how we should respond to global health inequities? These conversations are more important than ever as we see inequities in global health widen, not narrow. It's critically important that academic institutions like ours, like the University of California, start asking harder questions about who we are, what we stand for, what authentic global health partnerships involve. How do we do more to address these inequities, be more effective allies for our collaborators and catalysts for new, more equitable models for academic global health? So it's in that context that I am incredibly excited to introduce to you in a second our guest for today, Dr. Seye Abimbola. Before I introduce him, a word on format. The idea of this session is that for the first 20, 30 minutes, I will be asking some questions and inviting some audience questions that were submitted earlier. And then we want to make this as discursive as possible. My colleague, Naomi Baylor, will be moderating the second half of the Q&A. And we really want to welcome, we really welcome your input. Questions from all of you. So please be preparing your questions. I also want to note, though, that there are experts among us who, by virtue of your scholarship, your lived experience, and your country of origin, are experts in this field, and we welcome your perspective. You don't need to hide your comments as questions. We want to make this a venue where we can learn from you as well as from Dr. Abimbola. So one last thing. The nature of this format, the wide open Zoom means that everybody can hear everybody else. So try and remember to mute yourself if you're not talking. Raise a hand if you want to share a thought, or preferably, and at least initially, perhaps put your questions in the chat, and we'll get to them accordingly. Let me, though, if I may, introduce to you our guest for today. Dr. Seye Abimbola. We are so honored to have him with us. And Seye, I think you're here. I did see your face earlier. There you are. Hi. Good morning. Thank you for joining us. Really lovely to have you here. Let me introduce you to everybody. Dr. Abimbola completed his undergraduate medical training at Obafemi Awolowo University in Nigeria. After working as a clinician and researcher in Nigeria for several years, he completed his PhD in public health at the University of Sydney, and he continues to be a faculty member at the University of Sydney, as well as holding the Prince Claus Chair at Utrecht University with a focus on justice in global health research.
Also me, I joined a little bit later at what they are speaking, but they are speaking.
He is also the editor-in-chief of the BMJ Global Health, the journal that he actually launched as a doctoral student. And under Seye's leadership, BMJ Global Health has been a leading voice in advocating for greater equity in global health, while also espousing academic excellence and elevating the voices of researchers from low-income countries. He has won many academic awards and has been a leading voice in the decolonizing global health movement. Seye, we are honored to have you with us here today. Thank you for joining us.
Thank you very much for having me.
Maybe because you don't know this community, I can also take a minute to sort of turn the tables and introduce you to folks on the call. Now I don't know everybody who's on the call, but I know that there is a core UCSF contingent here. We are staff, faculty, students, mostly from UCSF's Institute for Global Health Sciences, and to use language that you're familiar with from your own writing. We are a mix of professors and plumbers, engineers and emancipators. And if you don't know what I'm referring to, then I encourage you to read Chayer's recent editorial. We've been meeting as a group for the last 12 months, trying to better understand how coloniality impacts our global health work and how we must do more to reimagine global health. And as a community, we welcome you today. Thank you for joining us. Chair, I recognize that it's for you. It's a Friday morning in Australia, and I'm curious how is the future? How is Sydney, Australia right now?
Well, we are in sort of trying to find our way out of the lockdown quite difficultly. The schools are on holiday, so my daughters are outside of the door, just next to me here. They could make an incursion at any time. But otherwise, fine. It's a bright, sunny Friday morning.
Great. I understand that there have been civil disturbance, at least in Melbourne. I don't know about Sydney this week, but I'm hoping you're keeping safe.
Yeah, thank you. Yes, it's much milder in Sydney, but yeah.
Well, as I said, thank you for joining us. If I may, I was hoping that we could transition to asking you some questions. And I wanted to start by asking you some questions about epistemology and how we use knowledge in global health more generally, and then ask you to speak more specifically to coloniality in global health. And I wanted to start with a paper that maybe some of our audience are familiar with, that you wrote recently on the foreign gaze. You wrote about building off the sentiment from Toni Morrison. You've written about the problem of gaze in academic global health. The notion that much academic research is motivated by a foreign gaze, and that foreign gaze perpetuates power asymmetries. You've asked, is that gaze necessary, inconsequential, or corrupting? And I'm wondering if you could just start by explaining us what do you mean by that, and what was your rationale for talking about global health knowledge in that sense?
Thank you very much. It's a good place to begin. In my role as an editor of a journal, I'm forced to often, sometimes unwillingly, make decisions about manuscripts. And so I've had to think a lot about many submissions, sort of pretty much the stuff of my daily life. And one of the things that strikes me as important has been the sense that a lot of the papers that I receive, I understand implicitly that they are not written for people in the country, for decision makers, for activists, for practitioners in the countries in which they've been collected, or in which research has been conducted, that they've been written for a different audience. And I'm interested in how a researcher or a research program's choice of audience influences how the research itself is conducted, the questions that are asked, the issues that are prioritized, the framing that goes into it. So I'll give an example. A project, say, in Nigeria about midwives. And this is actually a real example. Midwives, trying to strengthen midwives' availability in rural communities in Nigeria. I was involved in implementing that project at the national level. And I did a quick and dirty sort of analysis going by routine data, using routine data from within the program for working what was not working, how do you make it work better on an ongoing basis. And then a group from a very well-known global health agency, which I won't mention, came to us at the department and said, we want to conduct a trial of this thing that you're doing. And I understood, this was about 13 years ago, so it's a long time ago. I understood immediately that this was really a silly idea. To want to do that. Because the knowledge you need to improve that program, the knowledge you need to make that program work, comes from within that program. The best you could do about that program is make it work, connect it more to itself. What is working on the field, what is not working, salary payments, so very, very real life problems that are not, you can't abstract them into some yes or no, it works, it doesn't work kind of question. And I argued against that. But of course, my bosses very soon afterward told me to not make such arguments again, for reasons that I won't go into now. But of course, that study was conducted. The results are published. And thankfully, I did publish the quick and dirty version in PLOS Medicine in 2012. And if you compare the findings of the quick and dirty and the findings of this big trial, they are pretty much the same thing, right? Essentially the same thing. In fact, I would argue that the quick and dirty one tells you much more about how to make the program work better. So the first point is that the inconsequentiality of wanting to impress a global actor, because that was what this agency's intent was. We want to show that this thing works. We want to put it on the global stage, blah, blah, blah. I'm concerned about the inconsequentiality of that. And that's what I mean by, is it really inconsequential? I mean, how better could you spend those monies and resources? Right? The second is that often as well, as a Nigerian researcher and academic, I am convinced by my training and by whom I'm trying to impress and build a career off of, that I need to impress a certain audience. And that's the way I write about Nigeria, right? That I wouldn't write about Nigeria if I was writing for a Nigerian audience. That there are choices I make that I'm very, very keenly aware of. And I think they are corrupting in that sense, in the sense that which you tell lies or half-truths about the reality that you are trying to write about and influence. So there's also that. But I also recognize that in many instances, there is a need to write for a global audience, or a foreign audience, right? And in those instances, for example, I want to convince the World Bank to not do stupid things in Nigeria, right? I write for the World Bank and I write from a certain position. So there are those examples, but in that framing, I sort of made the argument that the ideal format, after all is said and done, the ideal format is that I'm writing for a Nigerian audience, but how to make Nigeria better, but how to make healthcare in Nigeria better. Now, that is the norm in the US or in the UK. Public health research in the UK is written, and the US, they are written for American audiences. They are targeted, they are clear. You can tell why this person is written what they've written. They are published in platforms and in avenues that are for the US audience or for the UK audience. But we don't have that. So once you zoom out of those sort of high-income country spaces where the academic and knowledge infrastructure is constructed to actually serve their purpose primarily, right? Once you move out of those places, if you come to Nigeria, you can't find a solid journal in Nigeria, for example, that sort of serves Nigeria the way the American Journal of Public Health serves America, or the way the BMJ serves the UK. Mm-hmm. Right? You don't have that. And so for me, I think we've constructed a knowledge infrastructure that is implicitly extractive in the sense that you take knowledge away, you divert the attention of those creating knowledge in those spaces to play on a certain platform that is far removed from their realities. And so for me, that was the message of that paper, that even before we begin to talk about authorship, about all the other things that we like to talk about, we first have to interrogate whom are we trying to impress? For whom are we writing these papers in the first place? And I just don't get the sense that we are clear enough in our head about what we are trying to do.
Yeah. A related question, to what extent is that sort of foreign gaze inevitable? We do live in a globally connected world. The origins and solutions of health delivery problems have both a local and a foreign application. I do contact tracing in San Francisco. There's a lot to be learned from how they've done that well in Rwanda over the last year. And yet, on the other hand, that foreign gaze, as you've sort of alluded to, can perpetuate epistemic injustice. It can frame the way that we generate knowledge, and you've spoken to this insofar as we look for external forms of validation on local knowledge, and we evaluate according to standardized measures that are global and not local. I'm curious to hear from you. How do we address that? You refer to it as epistemic injustice in a recent paper. What do you think we can do to prevent that, as you alluded to, global health research being extractive?
See, I think that the that there are, as I mentioned in an article that you already referred to earlier, that there are primary and secondary or subsidiary uses of knowledge. Right? And if you want to learn about how Rwanda has made contact tracing work in Rwanda, a good place to learn it is in a Rwandan journal, for example. A Rwandan shouldn't need to publish in the Lancet or American Journal of Public Health for you to learn that. And if they wanted to, my sense is that it should be of a secondary nature, right? They ought to, in quotes, have served Rwanda with that knowledge. And then the value that it has for San Francisco is of a secondary nature in relation to Rwanda. Right? And there are ways to do that, both theoretically, but also in terms of publication. There are, I very, very much appreciate the value of sort of evidence synthesis or knowledge synthesis. That, okay, there's XBC examples of contact tracing that have worked, not worked, performed, in a number of places. Then someone sort of sits and says, okay, I want to synthesize this so that people from everywhere can sort of learn from that. So I think a big part of the problem, and one of the reasons why I wrote the editorial on the use of knowledge, is to draw that distinction. That what I'm saying is not that everyone should be looking inwards, right? Only, but that we should serve primary, needs first. And we should orient our knowledge infrastructure and practices to serve primary needs first. And then secondary follows. And I believe secondary follows inevitably if we do the primary, right? It's the nature of primary things that secondary things, of course, then grow from them. But it's for me that we are taking the secondary things first, right? And we should do first things first.
Right. We have a question from the audience from Dr. Becker, one of our postdoctoral fellows, which is related. Nozifo, would you be willing to come on and share your question?
Yes. Thank you. Thank you, Mike. Thank you, Dr. Abimbola. I hope I'm pronouncing that right.
Yes,
you're wonderful.
It's very, very close.
How do I pronounce it correctly?
Abimbola.
Abimbola. Thank you. My name is Nozifo Becker. I'm a TEPS fellow here at UCSF, and I'm originally from Swaziland in Southern Africa. I have a PhD in public health, and my research centers around issues of HIV, food insecurity, and non-communicable diseases. So my question's a little long, please bear with me. So during my academic career, while reviewing studies conducted in developing countries, I began to feel that the act of collecting data in low-income countries was a form of data colonialism and capitalism in a way. Like when companies hire cheap labor in developing countries to mine for gold and diamonds, and almost all the profit goes to wealthy investors from foreign countries, while the local workers are paid below a living wage. So it feels to me that the current methods used by Western researchers among vulnerable populations in developing countries are extremely flawed and exploitative. It is all too rare to find a paper primarily authored or co-authored by members of the research team from the country in which the studies are conducted, when they often play a vital role in project implementation and data collection. Many times, local researchers aren't even fairly compensated or even mentioned for their contributions, while the foreign researchers, in addition to publication credit, receive substantial compensation or pay. So I'm just wondering what strategies are currently in place to address issues of data exploitation by Western researchers in developing countries, especially in sub-Saharan Africa. Thank you.
Thank you very much for that question. And it's something that I think about a lot as well. And I think a few things are worth mentioning here. Suppose the first is what we've talked about earlier, just rethinking what it is we are doing. Because I believe that a lot of those instances of foreign researchers sort of parachuting in and doing their stuff is just outright wrong and should not even happen in the first place. That often when you ask, whose question are you answering and for whom? for me, it's the most important question ever to ask a researcher, right? So whose question is it? And who's going to use it? And almost always, when you see a parachute kind of research endeavor, the answers to those questions take you in very, very bad places. So the first thing I think we need to, as a community, no matter how diffuse we are, to arrive at a place where we are clear about whose question and for which audience. Now, I've been involved in an initiative and hopefully a paper about to come out in the next 3 or 4 weeks with a group of journal editors, with a few journals around the world, and a group of researchers as well. We've together developed and recommended a what we call a reflexivity statement. It's a list of 15 questions that every manuscript submitted from a high-income country, low- and middle-income country partnership to a journal should include answers to those questions, submitted and published alongside the paper. And the questions include things like, whose question are you answering, or why have you chosen the authorship the way you've done? Why have you constructed the partnership the way you constructed it? What legacy is the project leaving? Where you conducted it? What training? So a list of questions. And in a sense, the hope that we have for this initiative is that it will people preemptively adjust their practices, knowing that they would have to declare what they did. And that process, hopefully, iteratively will change practices going forward. And I believe, broadly speaking, that this is a kind of initiative that need to become more normal in our field, sort of having rules to hold ourselves to account to, and forcing one another to make declarations about what we've done openly, so that at least someone can come and say, well, you told a lie here, or I agree this was the truth. And so I do believe that we need this kind of exposure, sort of self-exposure, as it were, and it might work.
I think we would all be interested on seeing that publication and those questions when they come out. So thank you for sharing that. And thank you, Nozifo, for your insightful question. I wanted to move on to more specifically talk about the focus of this seminar series, Decolonizing Global Health, along with leading voices, some of whom we've had come and speak to us at this group before, like Madhu Pai and Renzo Guito and Desmond Jumbam and Kai Mariah, who I think you may know. You've been a leading voice in this growing clamor to decolonize global health. You wrote relatively recently, I think, with Madhu Pai, the global health of our dreams is unrecognizable from the global health of today. And I'll be honest, our own UCSF efforts at decolonizing global health have been somewhat halting, in part because we haven't necessarily been able to clearly articulate a vision for this radically different future. And so I wanted to ask you, what does the global health of your dreams look like? If you'd be able to share such a lofty question.
Yeah, I will try to answer in a very concrete way. So you might notice that a lot of what I write and a lot of my responses today have been specifically in the space of academic global health. And I know global health is a lot more than that, but there is this particular beast that I'm interested in, which is how the academic infrastructure or knowledge infrastructure works in global health. And so when you ask what might that dream look like, a way of answering the question is if you imagine the structure of a research paper, the introduction segment makes a huge claim usually about a gap in the knowledge, a gap in the literature that the paper wants to fill. Now imagine if the introduction segment, the bulk of it, was committed to actually describing what was going on in the space in which the study was conducted before the research was conducted. What were people doing to solve this problem? What have they learned? What have they achieved? And then from there, you move into saying, okay, with all their learning and their achievement, here are the learning needs they have. Here are the knowledge needs they have. And here is why I am well positioned to be the person to help them answer those learning needs. And here are the questions that I'm trying to answer. Introduction segment, the bulk of it, committed to that. Method segment, you would go ahead and say, why you decided on the method that you decided on, right? And how that decision was reached in consultation and in discussion, right, with the people whose problem you are trying to solve, whomever those people are. And then in the findings, you lay out your findings. And in the discussion, the bulk of it also is committed to, okay, so how have they learned from what I've done? Right? How have the results and findings of the study been fed back into the learning process, and what has come up out of it? Now, a paper like that is very, very different from the current standard of a paper. It's very different. So that's an example of the kind of change that I'm hoping we'll get to. And as you can see, it requires standing back and reimagining what it is that we've accepted to be normal. And there are, just one example, there are many other examples of how we might stand back and say, how can this structure better serve its needs? So that's just one example. The other example, just quickly, is a lot of our research is directed at policymakers. Implicitly, we want to influence policymakers. And I often feel that we should have at least as many papers directed at policymakers as directed at activists. Because again, if we take seriously how change happens, anywhere in society, it's not from academic elites talking to policy elites. If anything, they are both reinforcing each other's status quo, usually. But it's looking at people who are trying to shift the landscape and working with them and sort of figuring out what are your learning needs. Right? If I want to convince the government of Nigeria to increase their budget on health, what are the learning needs of those who are knocking on the doors of the senators? So for me, that's the kind of shift that I'm hoping for. Sort of just a transformation, if you like, of how we imagine ourselves and our task.
That's a very useful insight. I have a couple more questions. I see that there's some from the audience, so I don't want to take up all of the time. You have talked a lot about the need for people to bring their lived experience and background authenticity into their work. In global health, there's a clear hierarchy of data and research and what's considered valuable. Nosifo talked about the need to decolonize data through authorship, for example. Can you talk about decolonization in the creation of global health knowledge and practice more generally?
I often feel that what we are trying to say when we are saying these things, the things that you've listed out, so data, knowledge, hierarchy, etc., is an invitation to a lot of humility. It is to say that first, whomever we are and whatever data it is we've generated can only guess at a slice of what is usually, if not always, a complex problem. And what we know about complex systems or realities is that they're always shifting. They are very contextually bound, and they have lots of power relations within them. So there are things that you can't say anything final about, anything conclusive about. It's always shifting. And whatever it is you have to say about it, data, whatever, often will say more about yourself than it is about that thing. Right? In other words, you are saying more about where you stand in relation to that complex thing, that complex thing itself. And so when I find in my interactions with people, and I discuss with people who don't agree with me a lot, so I know what people who don't agree with me think really, really well, because I take that very seriously. In my interactions, it often comes from a place of an assumption that where one stands, that what one can see, is sufficient. And for me, the big leap out of there is to begin by understanding that it can't possibly be. And it's a difficult thing to convince anyone of. And I know that. And again, given your proposed UCSF, you are thinking about that, about sort of how to make an academic institution work differently. I'm convinced that a lot of these beliefs come from how people were taught in grad school. I believe very strongly that the education, the teaching, education system is really, really deserves a lot of attention in terms of how people learn about their craft and about their job. It's where a lot of the norms are set. And when people get trained, for 5 years of a PhD, that where you stand is the ultimate. It's hard to shift that, especially when they are in a career in which they are trying to behave like people who have lived all their life, behaving like that. It's almost impossible. And again, I have these conversations very regularly with people. So I understand that the most important thing to do here is to dislodge ourselves from our centrality, to sort of get ourselves to a place where we are marginal and we are self-consciously marginal. And that is difficult. And I believe if we do that, all the other issues get progressively solved. In other words, you begin to give due respect and regard to the knowledge of other people standing at different points around the complex problem, some within, some without. You begin to value the data and the knowledge and the experiences they bring. I mean, it changes things. And so I believe it's a lot about us, frankly, how we've been trained, and we need to really, really take that very seriously.
How do you, that sounds like, trying to persuade people to embrace some kind of epistemic humility, in their training. How do you do that?
I think it's I'm not sure I have a good answer for you, but what I'm going to say, and what I've experienced in my own teaching, because I teach global health students and supervised PhDs, and I know that it's so apart from the problem of finding a teacher who's going to teach that, which is a problem that I think every university should try and solve, how to get teachers to teach that. The other problem is how to get students who will listen and take it, especially students who have lived all their life imagining themselves into the center of the world. And I've observed students struggle with that, because I try to repeat this message. I have a 13-week semester. I repeat this message in one form or another every week. And I see students struggle and struggle and struggle and slowly sort of begin to see what it is. So it's a huge task. I don't think I have a simple answer, but it's kind of task we need to collectively find answers to. How do we find the teachers, and how do we deliver the message in a way that allows the students to shift?
Yeah, thank you for that. I know that we have a few questions. Brina Kiernan had a question submitted before we started. So Brina, would you be willing to share your question? Then I want to open up for others as well. Maybe introduce yourself if you're able.
Yes, thank you so much, Dr. Abimbola, for this conversation. It's been really insightful. My name is Brina Kiernan, and I'm a program manager at UCSF's Institute for Global Health Sciences, working on COVID in California, and also working on our HIV PEPFAR work in sub-Saharan Africa. So my question for you is, if we are serious about doing the work to fight racism and fight colonialism, this means institutions like UCSF will have to give up some of our power, likely redistributing funding, either directly from institutions or directly from the funding sources from the high-income countries to low-income countries. And this will result in a loss of power. Do you think this is possible, and how can we make this happen? Would love to hear your thoughts. Thank you.
Another super big question. So when we think about incentives, you can think about incentives as sort of, in a sense, positive incentives, things that people do because they want to achieve something. Or you can think of them as negative in terms of things that people do because they want to avoid being seen as bad. Now, an example of positive that I give, and you can assess whether this is feasible or possible, is when the next time the NIH or the Gates Foundation or the Wellcome Trust or any big funder makes a call for application, that you find, and many of them, if not most, are deeply problematic or have problematic assumptions written into them about who should do the work and what they should bring. The next time, I've been saying this for a few months now, that I would love to see a group of 500, 600, 1,000 global health academics come together, sign a document saying we will not apply to this unless you change it in ABCDE ways. Now, for me, there's no change without that kind of step. And I'm waiting to see that happen at some point. And I hope it happens. So that's an example of an institution or a group of people wanting to say in a positive way, here is who we are. We won't sign up to this, no matter how much it promises us. And that's costly, but it's not impossible. Now, the second, in terms of sort of negative incentive is I think, the fear of missing out kind of incentive. I know that there will be institutions that will take, even if baby steps towards change in the coming years. And an incentive could be UCSF not wanting to be left out, not wanting to be seen as being slow, in a sense. And I feel, and from the feedback I get from many programs and institutions, things are happening within many places that I think signal a kind of shift. Now, I believe that we can't see change until we change the narrative. In other words, we need to, I believe very much that one should never run ahead of the narrative in terms of change. In other words, if you want to change something, first change the narrative and then let the steps follow the change of narrative. And I feel that we are in a space of a shifting narrative. The narrative is changing. At some deep level, people are potentially and progressively more uncomfortable with what they've taken to be the norm. And for me, that is we are in a phase in which change will likely more readily happen in terms of programs shifting, and UCSF may want to not be seen to be slow.
I think that's a really insightful comment. I think the flip side of that is, is what's happening. Even this session, is it just virtue signaling? Is there authenticity to that movement as UCSF, and other UCs engage in this sort of new framing around what we do? I wanted to call on Scola Matuvu, who had a question for you. Scola, please introduce yourselves and then share your thoughts. Thank you.
Thank you, Dr. Abimbola. Thank you so much for your presentation and, and your insights as well. I think this is a conversation in so many ways is overdue and yet timely. So thanks to UCSF that we're having this conversation. So I was struck by, the previous discussion we had around, who is primary, especially when you're looking at different projects and research questions asked. And I can appreciate, and I think most of us can, some of the competing priorities, some of the complexities around funding and our own personal interests, whether it's around promotion, tenure, financial and, other personal motivations that may be valid, but definitely we can see how those can perpetuate, negative outcomes. So I was thinking about what your previous comments were, as we look at this global, more than ever, this global environment or community that is much more permeable than before, given the public health crisis we're dealing with today as, one clear indication, and the need to unite and the need to, improve or increase collaborations and, in a more global health sense, that's transcending the boundaries, but with the same awareness of, our uniqueness and diversity, regardless of where where we are located. So how do we begin then to foster these collaborations, with shared interests? How do you determine who is primary when you have those shared interests and around research questions that are being asked? So that's one question. And I think the other question that I would also like to hear your perspectives on and maybe continue having the conversation is on, decolonizing the mindset. I think we talk kind of more generally about institutions and programs and funders, but these are made of people, are comprised of people and people whose intentions at times are not good in terms of, mindset that fosters, a culture, a healthcare culture, a global health culture that's inclusive and just. And, so what are the strategies around decolonizing the mindset of the colonized or disfranchised and the potential, perpetuators of different forms of discrimination.
Okay, so 2 questions there. Thank you very much, Scholar. Or just Scholar? Okay, thank you very much. So the first question has to do, I think, with the issue around what is primary and what is secondary, especially in a hyper-connected world in which we have shared interests and sometimes even shared research questions. Now the way in which I would think about that, or the way in which I think about that, is that there's this common saying that charity begins at home. That in many instances, COVID-19 vaccine is a very good example of that. That India, for example, at the beginning was very willing to share until it got hit, and then decides to stop sharing, and then it's reopening sharing, hopefully next month. In many instances, if not most instances, the knowledge needs that Uganda or India has are very Indian knowledge needs. Now, I would argue that the knowledge needs that are shared are perhaps 20%, generous 25% of the knowledge needs, if you sort of want to give proportions to it. In other words, those instances in which we share research questions, or those instances in which we are weaving ourselves together, we are building global collaborations to solve a problem, they are not the majority of the knowledge needs that each individual space that contributes to that collective has. Again, for me, it goes back to the primary, secondary sort of distinction. That if we are taking care of the primary, of course, I'm really excited about those secondary ones. If we are doing the primary job, but I don't think we are anywhere near doing the primary job really well now. So I'm going to be making noise about the primary until and I won't center those secondary ones in my thinking and in my analysis for now. But I can imagine myself, in a future, if I'm still alive when the change happens, that I begin to say, okay, now we need to focus on the secondary, and we need to, ABC. But I don't think we are there yet, honestly. On the question about decolonizing minds, I don't think I've used the word decolonize at all today. I probably have used it for the first time just now, and for me, it speaks to the idea that decolonize is such a huge word and such a huge concept. And it means different things to different people in different places. If you say decolonize in South Africa, it's different from what it means if you say decolonize in India. Right? The two people in those places would think about the word in completely different ways, given their history and their present. So and then if you talk about it in a discipline like global health versus, say, anthropology, or versus, say, epidemiology, you're talking about different things. They are connected, but they are different. And we're talking about it in a sort of settler colony like the US and Australia versus a place like Nigeria, Uganda, that are not settler colonies. Again, they're different. They're talking about different issues in each of those places. So it's a word that I generally avoid. And instead, I discipline myself to only use the word once or twice in most of my editorials. So I just drop it once or twice and I just let it go. Because I think we can get at that concept and get at what we're trying to achieve without necessarily talking about it centrally or primarily. We can have a conversation about epistemic injustice. We can have a conversation about how academics should be trained and humility. We can say a lot of things about what we need to decolonize without even talking about decolonize. And I do believe that is one way of approaching the problem. That it's in the mind, as you say. It's how we think about the world. It's what is primary for us and what is secondary. It's also how we understand our history. As a Nigerian, for example, I understand that there's Western colonization, but there are also internal colonizations. So that when I talk about decolonization or colonization to someone from a part of Nigeria whose people have been colonized before the Brits came by other groups of Nigerians, he says to me, but you're not talking about that, because that's also important in a long history. So for me, it's about the mind, understanding very clearly what history has done to all of us, and it's all of us. For me, it's all of us. There is there's a line from James Baldwin who said a lot of interesting things to white America, but in this particular version, he was saying to white America that what you don't know about me is what you don't know about yourself. And in many instances, we are all we're all suffering, whether we're perpetrators or victims, we're all suffering from the same thing that we need to break our minds from. And it's a lifelong task, and it's a task of education, in my view, because I believe that our educational systems have been designed to tell us a lot of lies, and we have to undo them one by one over time. And we can't solve these problems without approaching them with a clear mind that actually has truth fed into it.
Yeah, thanks for that profound thoughts. Apologies to Willie Ferralis, who's been patiently waiting to share his questions or comments with you. Just a reminder before Willie jumps in, if you have a question, either raise your hand or put it in the chat, and my colleague Naomi is going to jump in and moderate in a second. But Willie, do you want to introduce yourself and then share your question with Seye?
Yeah, sure. I cannot turn on my video because the host has stopped it.
Apologies.
Thank you. Access. Hi, my name is Willie Ferralis. I work at the Center of AIDS Prevention Studies at UCSF. I am a counselor on a number of different studies. Oh, hi. And I'm trained as a somatic psychotherapist. I'm deeply engaged in work around liberation, understanding systems, how systems work, oppression, privilege, mechanisms, institutions. And I really appreciate hearing what you've had to share. I really appreciate your approach, your insights, and was struck by your offering of how you would ideally write a paper, like looking at the structure of how we do things and what that easily allows or doesn't allow. And that really feels central to some questions and things that I'm holding around academia in particular. Because the words that come up for me that I feel resonant in what I heard from you were legibility, and I can't remember the other one, but I'm sure I'll talk about it. But so my experience in academia, both through my grad school program and just in my work here, is the academic voice. How we're meant to write, how I was trained to write, is very emotionally and personally sterilized. That I'm to completely remove myself to achieve some kind of objectivity, but objectivity that I've been shaped to speak in a particular. I had to learn a language. I had to learn a language that most people don't even speak. Like you said, is for policymakers, is for probably other people in academia. It isn't necessarily at all accessible to people who are experiencing their daily lives, who are being studied, who are maybe feeling a lot of pain, oppression, genocide. In my experience, this language and convention does not allow for the easy expression of human pain and urgency. And so I experience academia and science to be very, very slow at affecting change, because it has to go through all of this work and learning and talking about other people's studies. And, for myself, understanding my own issues, how many generations of sacrifice my ancestors had to make, and forfeiting of their own humanity to survive the system and afford me the privilege of both being able to learn the language of the oppressor and being able to still be in touch with that humanity that I was able to uncover in, putting my humanity aside to make it through academia, to then be able to bring them together, integrate them, and communicate them. Like, this is very, very costly. And I think of Audre Lorde, who described herself first as a poet and then a theorist, saying the master's tools cannot dismantle the master's house. And so I'm hearing you, talking about structuring papers differently. I'm thinking about the needs for we're not meant to be legible. So much of this is not meant to be legible. Nigeria isn't meant to be legible to the powerhouses and funders from the United States and the UK and what we call the Western world. So I'm wondering, how can we grapple with this idea, if you agree with it, around legibility and around this feature that I believe is like designed to actually not be changed and disturb the balances of power that I believe all of us here have had to navigate, negotiate for our own security, and have to do our own work in, illuminating and divesting ourselves from. So those are some thoughts and questions peppered in there. I'd love to hear you speak on.
Thank you very much. Another really heavy one that I also spend a lot of time thinking about. Now there is the difficult reality that what we have is the world that we've been served. We can't imagine ourselves, or rather we can't pretend as if it's not what the world is. And so there is a level at which we have to grapple with that world. And to the extent that we want to change things, there's an extent to which we have to face up to it and change it. Now I understand the sentiment of the master's tools will not sort of dismantle the master's house. But I think the master's tools can weaken the master's house sufficiently enough to remold it. And I believe I don't believe that I have many other options than that. I was born in Nigeria. It wasn't my choice. I'm a Yoruba person. There was a Yoruba nation before Nigeria came to be. But I don't have that, and I can't pretend that I do. So there is a part of me that really, is committed to holding this thing we have in our hands and really deeply interrogating it, and really deeply finding the weak spots and the leverage points at which it could be shifted. Now, I do believe very strongly, and I've made these examples, that journals can be changed in time. And journals is one of those entities that set norms and sort of can shape incentives. And I think a lot in this space around what happened, and I'm beginning to study this in a more disciplined way as a researcher, how the evidence-based medicine movement changed clinical medicine over about 30 years, beginning in the early 90s. Now, if you read that history, which I've been reading a lot in the last few months, it sounds very similar to what we're going through now in our discussions around global health, right? There's this narrative about expertise as well. There's a narrative about the power of doctors. There's a narrative about who makes decisions and whose knowledge matters in a clinical encounter. And now it's not changed as much as I wish it did, clinical medicine, but when you look at the footprint of that movement and you look at the footprint of the changes, they created a new discipline. Clinical epidemiology didn't exist before them. They made systematic reviews and meta-analysis into a thing. It wasn't a thing in medicine before them. They created clinical guidelines to structure the clinical encounter. Those didn't exist before them. They created reporting formats in journals and a monitoring framework for them. Those didn't exist before them. So for me, it's looking at the system and asking ourselves very honestly, where are those points in the way the system works that can allow me to insert myself and shift? And I think there are a few such points, honestly. And it's worth trying, the other option is to just sit back and say, I can't do anything until, everything changes.
Thanks for that. We are at the hour, and so I want to be respectful of people's time. Seye, this has been just a rich discussion, and I think everybody on the call is grateful for your insights, the profound perspectives that you're bringing to discourse of global health. If you have a couple more minutes, then I know that Deli had a question. I wanted to give him the chance, but I also want to respect other people's time. And so if you want to step away, please do so. Thank you for joining us. We will be meeting again October 28th. But Deli, are you comfortable to introduce yourself and ask your question? Great to hear from you.
Oh, you're so generous, Mike. Thank you so much. I'm Dele Ogushetu. I'm not at UCSF. I'm at the sister campus, UC Irvine. And I'm affiliated with the UC Global Health Institute, and I coordinate the education program there. I've been engaged in the last 2 years with the USAID project on One Health Workforce Next Generation. We work in 17 countries, South Southeast Asia and Africa to train and empower faculty and students in One Health. And we've confronted this topic quite a lot. And it's not clear. I put in the chat, just because we don't have a lot of time, a debate about what happened to the Global Forum for Health Research. It's very similar, because my very first project in global health was funded by the Global Forum for Health Research, and they wanted to correct the 1090 equity problem in global health. But I wanted to ask about your next steps for you. So we don't ask Pfizer not to conduct research, for example, right? We ask them to, at the end of the article, a disclaimer, conflict of interest, and we have checks and balances. Is this something that you would explore implementing for an academic job, for example, in this kind of situation?
Yes, absolutely. In fact, I do believe that these kinds of efforts to shift practice, as you say, Pfizer conducts research. People conduct research for Pfizer. People have a lot of conflicts of interest sometimes that they have to declare. Journals decide whether to publish or not. For example, the Lancet will not publish if you have certain kinds of conflict of interest, same as the VNJ. So there are those rules. But I believe as well that we will need to get to a place where we begin to spell out what those are. So for example, should World Bank staff evaluate a World Bank project in Nigeria?
Yeah.
Right. There was such a paper published just yesterday, and a friend of mine sent me a message like that. Should World Bank staff evaluate a World Bank project in Nigeria? Exactly, a program in Nigeria that I was quite very familiar with. And so those kinds of questions, I think we will have to get ourselves to a place where we ask them openly and agree on them, and disagree, sometimes have debates. But we would have to set those rules, which we have. It's been a free for all, in my view, space for a very long time. Anyone can pretty much say anything and do anything and evaluate anything. There have been really, really interesting. I often can't say all that I experience as a journal editor, that things that don't get published, but that don't get published because they will get the journal in trouble for not publishing, but I'm privy to. There are many, many examples of deep conflicts of interest, especially in program evaluation, often by funders imposing themselves on the analysis, on the question, and on the final result, on the final paper itself. And so there are all these things that happen in the background. And for me, I believe that we have to get ourselves to a place where we can have these conversations in the open and we can set rules. And I do believe that universities and academic journals have a huge role to play in first shifting the conversation, as I said earlier, to a place where we can even make the rules in the first way that people will abide by and subscribe to, because there's no point having rules that people bypass. We need to get ourselves to a place collectively where we all agree that there is this problem and this is a potential solution and we are willing to try it out. So I do believe, frankly, Dr. Ogunseyitan, that we do have to get to that place.
Thank you. Please call me Dele. I will end with Yoruba proverb. I'm sure you understand that. It just means that, when you convene, I think you have a platform to convene such a meeting of the heads. So think about what kind of language can we put into publications to be more transparent about these poses and that you engage those who are working in different parts of the world to that conversation. So thank you so much for allowing me to ask that question. Yeah.
Thank you very much.
Seye, thank you so much. I think we've all benefited from your insights. I appreciate that it's getting on in the morning. It's probably mid-morning for you on Friday, and you have work to do. Thanks for taking the time to meet with us and sharing your wisdom with us. And hopefully we'll get to hear from you again. Everybody is writing in the chat how much they appreciate your perspective. So thank you.
Thank you very much.
All right. And thank you everybody for joining. We really appreciate each one of you attending these sessions and engaging in these difficult but really important conversations with us. So thanks for participating in this afternoon's conversation. Have a good day.